All right, good afternoon, and thank you for attending our next weekly financial meeting. As you know, I am Catherine Ruiz. I am the Bureau's rates analyst. We have a lot of new people joining the meeting today, so just as an FYI, our housekeeping procedures, if you want to hover your cursor over the bottom of the Google applet, and you can mute your audio and stop your video if you don't want to be part of the recording. So just as an FYI, this is being recorded. It will be uploaded to the ground ambulance website, and the chat box is part of that recording. So if for some reason you wish to not be part of that recording, be sure to mute your audio, stop your camera, block the camera out, whatever the case might be. So to our presenters, be sure to mute yourself when you're not presenting. Our lovely Taylor will be presenting the materials, so there's no need to screen share. And the *6 is to unmute yourself. So when it's time to present, go ahead and do that. So I want to apologize also for the multiple updates to the agenda this morning. I kept clicking to Google not to send the new updated agenda since it would just be posted to the website, but apparently Google had other ideas of what to do. So I apologize for those of you that received multiple emails from me this morning. I know for some reason the call-in feature is having some difficulty. So if you know someone else who's having trouble signing in the chat box, there's an alternative call number with an alternative passcode so people can join the meeting. So let's jump right in. Actually first, if I could actually have our presenters go ahead and introduce themselves. As I said, we do have some new people who are joining the call who have not been on the calls previously. So I would love and appreciate if our presenters could go ahead and introduce themselves, who they represent, and everything to that effect. So Paul, if you could.
I could. I am Paul Peterson. I am the co-founder, co-owner of Arizona Ambulance Transport in southern Cochise County. Our business primarily is bringing sick people from Cochise County up to Tucson for a higher level of care. I also serve on the board of directors of the American Ambulance Association, so that keeps me up to date with what's happening nationally.
Okay. My name is Jason Taylor. I am an advisor with Mesa Fire and Medical Department, and I also serve on the board of directors of the Arizona Ambulance Association.
And this is Edward Armijo. I'm with American Medical Response, and my position there is manager of governmental affairs.
Thank you so very much. All right, so then we'll jump into the agenda. The first thing on the agenda is the Bureau distribution of money to the 4 regions. So you've got a hyperlink there to the 4 regions if you don't know which region yet you are. And we do have some updates regarding that. So I know a lot of providers have been contacting me and contacting the regions regarding the application status of this funding. So I want to provide some information to you as I have it. So WACM's application is going to be located under the Provider Assistance COVID-19 hyperlink. So if you go to WACM's website, if we can go ahead and click on that hyperlink. On the right-hand side, you'll see another hyperlink that says Provider Assistance COVID-19. And if we go ahead and click on that Provider Assistance COVID-19, Provider Assistance COVID-19, a little bit higher, lower, there we go. Then that right there in the center is the hyperlink for the application. It doesn't quite look like a hyperlink there in the center, so I just wanted to bring everyone's attention to that. So AIMS, if you're part of their listserv, you already got a link to their application. And if you're not part of AIMS's listserv, if we could go back to the agenda, please. There's a hyperlink there that will allow you to go ahead and apply. So there on the right-hand side, it says also here. That's where you would apply there if you are part of AIMS's territory. Sames and names, application is definitely coming soon. So if you're not part of their listserv, I would advise you perhaps to look into that. So I just want to advise people that the feedback that I've been getting from the 4 regions would be that emailing them directly asking for, let's just say, $5,000 for PPE is definitely not akin to submitting an application. Each of them has their own application process. Some of them are updated and are uploaded and ready to go, like WACM's and AIMS. SAMES and NAMES are very close behind. So I just want to be aware that this is sending an email to them asking for 5,000 is definitely not akin to submitting the application. So just be patient. It's going to be posted online. It will be available soon. And be ready to demonstrate your need. And that varies from person to person on what it is that you need and how much it is that you need. There is no definitive process on how that is to demonstrate need. So that's up to you. However you think that might be, whatever supplemental documentation you might have to demonstrate why your area needs this funding. So be ready for that. And the last thing is not to ask for items that are not on the list. So if you can't ask for land, don't ask for land. If you can't ask for a 3D printer, don't ask for a 3D printer. Definitely only ask for items that are on the list. And that's the feedback that I have received. WACMS does have a deadline of June 15th. So if you want some of that funding, be sure you get your application in by that deadline. Ames stated that once you click that, also here, you'll have a needs assessment in which you will define what your need is. After that, you'll be directed to the application process. And the last part of their application process is all applicants will be voting on who should be getting that funding. So that's the feedback that I have so far regarding that funding. So if you're not part of their listserv, I would highly advise you to sign up. And that's all on their websites as well. You have hyperlinks available to you in which to do that. SBA and the PPP loan forgiveness has been published. That came out last few days. And they do have several federal contracting programs that are available as well too, which have always been available. And we're going to have a follow-up presentation from Shivani Dubey. She's going to be presenting next week regarding that PPP loan forgiveness. I know we have several providers in the state who were lucky enough to get that program and be approved for that program. So Shivani is going to be jumping on board next week on May 28th to present what that is, and also on the federal contracting programs that's available to them. We have had several providers who have participated in that programming before for the federal contracts. So I'm going to reach out to them and see if we can get them to give a little bit more information on that. And if you are the part of the rural health associations, or if you're a rural provider, you might want to check out SBA's Rural Affairs Office demand webinar. You've got a link there. So it's on demand. It's for California, Nevada, Arizona, and Hawaii. So they're on 1BIII. You've got a hyperlink there if you want to get that information regarding that webinar. Check it out. Just got to register and go for it if you want some of that information regarding the rural provider funding. CMS published an additional waiver, which I just got this morning. So if you just joined us, I'm so sorry if you got a million versions of the agenda today. I had a lot of different things drop in my lap this morning. So the CMS additional waivers is regarding hospitals and ground ambulance providers, new guidance and new waivers for those. So the hospitals, it's going to be modifying the existing physical environment waivers to allow flexibility for surge capacity and patient quarantine. And it's got a lot of information in there regarding screening possible COVID patients off-site to prevent an infection, changes to verbal orders, reporting requirements, changes to patient rights regarding the participation of treatment plans and discharge plans. Medical staff expiration dates have been temporarily waived so that they can continue staffing and working in the hospital given the crisis that we're in. There's a lot of information for hospitals. For ground ambulance providers, the only information applicable to you is at the bottom of page 29. And at the bottom of page 29, it states that there's modification to the data collection reporting periods. So that's the only thing that's applicable to ground ambulance. The rest of it is riddled with information regarding hospitals. So definitely take a read on that if you have any questions. There is we do have the news announcement that was attached to the email as well, dated May 15th. That was one of the supplemental items that got sent out by Google. So if you want just a summary, the news release has a lot of different hyperlinks that are available and helpful to gain more information. And that's the other additional resource document that might be there, if we can pull that up. I was sent in the email, so I guess it's not on the agenda. It was sent via email, so I'll just post that to the website so that we have that handy. The next thing is Federal Reserve loans. 2 weeks ago, we presented how this was coming soon. And this funding also fell in my lap this morning as being available. So that money is available for small to medium businesses that were performing well prior to COVID. And as long as you're eligible if you have less than 15,000 employees or less than $5 billion in revenue. So the program terms and FAQs, we have a hyperlink there. There's one webinar and one drop-in session. So if you want to attend the webinar, it's coming up on May 29th. The drop-in session for specific questions is June 3rd. Due to demand, they would appreciate if you only had 2 representatives from your company in each session, not more than that. If you have any questions about the programs, you have 2 emails there that you can send any questions regarding. So that was coming soon, and now it's available. If you click on the Federal Reserve loan hyperlink for 1D, it has a lot of information about the different programs that are available. There's quite a few supplemental information at the bottom of the different types of programs that they have for lending from the Treasury Department. So check that out if you haven't. This is definitely available to some of the larger businesses, which have, again, less than 15,000 employees. That definitely is a good amount. All right, well, that's a lot of information all at once regarding funding. And again, for those of you that are interested in SBA, if you haven't contacted Shivani Dubey already about your PPP or EIDL loan, she will be presenting next week. So with that, I'll hand it off to Paul.
Thanks, Catherine. So number one is the PSOB. That's the Public Safety Officers Benefit Plan that provides several $100,000 to the families of cops and firefighters who are killed in the line of duty. A bill passed in the Senate, not the House, but it passed in the Senate, that would basically make any COVID-19 death at this point in time presumptive that it was line of duty. So that's working its way through the Congress. We're also trying to, the PSOB only covers public employees. Our association is trying to, for the COVID-19 time period, add private sector ambulance providers as well. Everybody has been, or I think most everybody has received some money from HHS in round 1 and round 2. There's still money in the account, so we're anticipating that there will be a round 3 of that money. I continue to see at least weekly, if not more, stories in the press about EDs and low volumes. So that apparently is not changing much. And then I've got a few things not on the agenda that just really came up this morning. One of the ones that's kind of a continuing thing is the whole treat and release. Across the country, it's a big deal. There are a lot of ambulance providers who are treating and releasing particularly COVID patients at home rather than taking them to the ED or hospital. I don't know how much of that's going on here, but our association has been working really hard to try and get Medicare to pay for it, which they won't at this point in time. Medicare informs us that it will require a legislative change, so we're working now on the next CARES Act to get that inserted into the bill. This morning, I had occasion to sit in on a webinar with Senator Bill Cassidy from Louisiana, and he had some interesting things to bring up. There is a movement in the Congress to make some changes to the PPP, the Payroll Protection Plan, for those of us who have received that. Right now, you've got to spend the money within 8 weeks. They're interested in pushing that out to 24 weeks. Really, it's for restaurants because we're in places where they're closed, they can't hire people. So we're hoping to see that may change, and they also may modify the 75% rule that requires that 75% of PPP funds be spent on payroll. Now, interestingly, subsequent to this webinar this morning, I read that the Secretary of Treasury says that any changes to PPP has to be done legislatively. So that ain't going to happen today or tomorrow, but that's still very much a topic of discussion in our nation's capital. And the last thing I have, and this really is for those of you who are with municipal fire departments. You know, you guys are going to see a huge, or your cities are going to see a huge decrease in tax revenues next month. And you're probably aware that the House passed a CARES 2 bill a week ago or so that had a lot of money for cities and states in it. However, that bill was DOA in the Senate. But Senator Cassidy, who is a Republican, has introduced what they're calling the SMART Act in conjunction with a Democrat that would provide $500 billion to cities and states. That probably isn't going to get passed, but the point here is that there is obviously interest from both sides of the aisle in getting money to cities and states. So you guys stay tuned for that. Jason.
Well, before we jump ahead, we also had the HHS.
That was the round. I'm sorry. That's the round 3, and those of you, which I'm guessing are most of us, have received it. You are aware, and if you're not, there is at the HHS website information on these grant opportunities. But the first one, it just showed up. The second one, we had to do some applying, and I know there was a problem with government agencies not having tax returns, but I think that Jason is going to talk about that.
And then we have some grant opportunity, a hyperlink there for 2BI for people as well, if you're interested in other HHS grants. And then there's also another hyperlink there for policies and regulations regarding said grants. So if you want to check those out, if you are looking for rules, regs, guidance, or additional funding opportunities, those are definitely helpful for you. Sorry. Jump right in, Jason.
Thanks, Catherine. Jason.
Okay, that's actually a perfect segue, Paul, talking about some of the documentation uploads related to HHS stimulus, aka the CARES Act Provider Relief Fund. We hit this every time we have the call, and I think the reason is that it's very very fluid process. Every time I check the CARES Act Provider Relief Fund website, there's a change on there and new guidance. So I'm going to kind of hit it from a high level, and it would be great if we could have a little discussion about some of those document upload issues that Paul talked about. But basically, following up on some of the administrative items with that HHS stimulus, there's basically 3 options that you can take as a provider. The first option is to maintain eligibility for all payments that you've received beyond round 1. So round 1 was that automatic payment, and then there was a round 2 payment that for most providers you had to upload some information to even be considered. And then Paul talked about the potential for round 3. To do this option, to maintain that eligibility, you have to use the attestation and general distribution portals to accept HHS terms and conditions, and also to upload your revenue information. And this is in the form of tax forms, or if you're a government providing entity, upload your financials. And then you also have to upload what your lost revenue estimates are for March and April of 2020. I don't know if Taylor, if it's possible, and sorry to put you on the spot, if you're able to just Google or go to the CARES Act Provider Relief Fund. It's the first thing that pulls up when you Google that. And I just think it might be good if everyone can see where those portals are.
I'm sorry, did you say that it was already a link, or just type it in?
Type it in. If you could just search for on your browser for CARES Act Provider Relief Fund. And the reason I'm asking you to pull this up is this is really the go-to, and they do a good job of linking everything, the distribution portals and attestation portals. Yep, right there. So everything is linked here. If you scroll down just a little bit, Taylor, they've got those orange rectangular boxes there. Those are the portals that I'm talking about. And that's where you'll go if you want to go with option 1, which again is to basically stay eligible to get any funding that was after that first round, including potentially this round 3 that Paul talked about. So talking about the challenges with it, Catherine, jump in here. You had said that you got some information about some providers about some either challenges or successes with actually uploading some of their revenue info. You want to jump in here?
Certainly, thanks, Jason. Rincon Valley had previously told us that the ARCRs were acceptable when it came to some sort of financials for some of those smaller providers that might not have audited financials or CAFRs. Recently, I spoke with Verde Valley, and they said that the government who's taking this financial data and reviewing these attestations are aware that there's issues with uploading these documents. We've been hearing time and time again that submitting this financial data has been riddled with issues where it'll spin and spin and won't take. We thought that perhaps it was a size issue regarding the size of the file, but Verde Valley was able to confirm that it's not size file specific. There is no maximum on that size. It's purely an issue on their side when it comes to this portal. So if you're having issues with that, they're aware, they're working on it. We're hoping to get an update from them regarding what to do if they still can't upload financials within the next 2 days or so. So hopefully next week we'll have more information, but there is a phone number. If we can go to the agenda, there's an 866 number. You'll need your tax ID number and everything to that effect to sign in. So 3A has that 866 number right there. So you can give them a ring. I tried calling them, but obviously I don't have a tax ID information regarding, since I'm not a provider. So they can speak to you directly and probably make a notation on your account if you're trying for a week to 10 days and still can't get your information uploaded, like Verde Valley was experiencing those issues. So give it a try. Hopefully it works for you. If not, we hope to have an update soon. So that deadline to accept is by June, it looked like it was June 3rd for the HHS website. So if you haven't signed your attestation and you haven't returned that money, they're going to assume that you accept the terms and conditions. So, and I'll hand it back off to you, Jason.
Yeah, and then I can actually speak to this a little bit, because just yesterday I went ahead and did this for Mesa. The upload worked fine for us. I uploaded our ARCR and also Mesa's CAFR, Comprehensive Annual Financial Report, which is a pretty significantly sized document. I was fortunate in that I didn't have any problems. It only took about 5 or 10 minutes to do everything, including estimating our revenue losses. And then I also went ahead and called that number just with general questions, and someone picked up within 3 rings. Just a heads up that if you call that number, it is a representative from United Healthcare Group, representing that they're essentially serving as a contractor for the government. So don't be caught off guard on that. But they were very helpful and responsive. So backing up a little bit, I started this area talking about the 3 options that providers have. We spent most of our time talking about that first option, which again is using those portals to accept those conditions and maintain your eligibility for all future payments. The second option is on the other end of the spectrum. If you don't want to be eligible and you don't want the money, you can return the funds that were automatically distributed to you. For most of you, this was done in that first round. It just showed up as a deposit in your bank account. You have 45 days to pay that back if it was paid to your account via ACH, or you have 60 days if it was a check payment. On that same website that Taylor had pulled up, there's a frequently asked questions page on there. Let's see.
It's also linked in one of our previous agendas.
Okay, excellent.
Jamie has a question. Has anyone received round 2 funding?
I'll pause for a while and let anyone respond to that. Or actually, I'll tell you what I'll do is, Catherine, just interrupt me if someone responds via comment. Does that work?
Sounds good. We can keep going. We're going a little long today.
Yeah, sorry. So in that frequently asked questions, it's got some of the, on pages 2 and 3 of that, it has the specific details of what you'll have to do with your financial institution. It gets a little complicated if you receive the funds via ACH. And then the third option is kind of the middle ground between those. A lot of providers may have done their estimate and realized that they're not likely to get any additional funds after that round one, or they might not need additional funds. So if that's the route that you want to go and you don't want to be eligible for any future funds, and on the other hand, you don't want to pay everything back, but just stay with that round one funding, then you can accept the terms and conditions in that attestation portal within the 45-day window, or actually by they have a June 3rd date now listed. But note that, like Catherine said, that if you do not take action on it, you're also considered to have accepted the terms and conditions. So make sure and take action if you want to pay that money back. I'll hit the other areas pretty quickly here. The first one is the TAGS, or Tracking Accountability and Government Grants database. This is kind of an information-only database of grants that have been awarded by HHS, awarded by their 11 operating divisions. So it's useful if you want to see which entities have received what grant funding, how much they received. There is an advanced search feature there that allows the user to get pretty granular. And I don't know where it is. It's on the very bottom right there, Taylor.
Just
there's
scroll down a little bit. Yeah, right there. Word search, recipient search.
So that if you click on that advanced search, there's it allows you to get pretty granular with what your searches are. My understanding is that's kind of an information only area. Then there's two more grants that we became aware of that I'll touch on. The first is the COVID-19 Emergency Response for Suicide Prevention grants. These are offered by the Substance Abuse and Mental Health Administration, and it's to support communities that are struggling with suicide and domestic violence due to the COVID crisis. The maximum award amount is $800,000 per provider, and there are no cost sharing or match requirements. Eligible providers are tribes, counties, emergency departments, and community-based primary or behavioral health care centers. The deadline to apply is May 22nd, and Taylor has, that is tomorrow. Wow. Okay. So get on it if you want that one. The other one is smaller scale. This is the SAVIC Cost Collection Grant. Someone correct me if I pronounce that name wrong. SAVIC is a nonprofit public safety buying group, and this grant is offered by them and by the American Ambulance Association. It's for rural and super rural ambulance providers to help them prepare to comply with Medicare's cost data collection program. What it is, it's essentially a 1-year gold subscription to the American Ambulance Association's ambulance cost education program. So access to experts on cost collection, access to a cost collection software solution they have, and then free registration to webinars and regional workshops. One quick note is you have to be a member of SAVIC to apply, but you can join that for free, and Catherine included the link to join on their website. And absent any questions, that concludes my portion of the agenda.
Yeah, on the agenda, there's got a hyperlink there that says join for free on 3D. So if you want to join for free to apply to that, you've got a hyperlink right there. So last but not least, Ed, if you could.
Yes, my section right here is begins with Health and Human Services research grants that are available. This is to research. Their intent is to fund research studies on all healthcare settings, which will include pre-hospital care, and specifically for the safety and value of the healthcare system response, and to identify affected socially vulnerable and people with chronic diseases, and the integration of digital health. So that's specifically to do research, and they provide that funding for that. You can go on there and you can apply for the research fund or the research grant on that if you link there on number A. Number B is HRSA, Health Resources and Services Administration. This is a website that provides access to a variety of available funding under a group of HRSA programs, such as Office of Rural Health Policy. A sample of that is Rural Tribal COVID Response Program. The website gives you like about 5 different programs that HRSA manages, and then under each one, as you click on it, under each one there is specifically locations where you can pick up different types of funding alternatives. So that's a good one to go look through and see if you can find anything that's available. It doesn't specifically identify only COVID, but there's a lot of stuff in there. Last is C, Federal Communications. This is Federal Communications COVID-19 telehealth program. This program will provide immediate support to eligible healthcare providers responding to the COVID-19 pandemic by fully funding their telecommunication services, information services, and devices necessary to provide critical connected care services until the program's funds have been expended or that COVID-19 pandemic is ended. You have to please note on there, there's a note, telehealth program is limited to nonprofit and public eligible healthcare providers that fall within the categories of healthcare providers in section, and then it goes to the section of the Act. And then they also give you an opportunity to go get additional information right there at the website. That's good for me.
And they email better than they call. So if you try calling, you'll probably get shifted to a voicemail. Emailing is the best way to get more information on this program. So there's a lot when it comes to this. I want to stress when it comes to what Ed talked about, the research COVID grant that's available, since there seems to be a lot of research when it comes to the response regarding ambulatory care during this COVID crisis. I just want to also present this not just for the people who would want to research this, but also to be aware that this is something that people are getting grants for. That might be something where people's seeking data, looking at that data. I know everyone already knows we're already under a microscope when it comes to how and what we do, but I just thought that we would be aware that that's coming out as well too. So if that's your forte, if you have a great research team, a great data team, this might be something that's up your alley. And last but not least, that telehealth program that Ed was talking about, that's also eligible for teaching hospitals and rural healthcare clinics. So if that's you, that might be something that would be helpful to you, especially with all these other CMS waivers regarding telehealth programs that are expanding the ability to utilize telehealth for multiple reasons and multiple opportunities. That might be a great opportunity for some of our providers. So just to close up for our closing remarks, it's not on the agenda, and I want to definitely communicate that with all this additional funding and everything that's happening regarding that, I've been asked by a few providers about how that affects the ARCRs, being that in a month, the fiscal year is going to be ending roughly, and how if someone receives some of this funding where it can be backdated, how is that supposed to be reported? And that guidance is coming soon. So just to be aware of that, it's on our radar. We're discussing it internally to see how and what that would be reported on said ARCR. Being that this is such a unique event, we don't have any standing guidance regarding that topic. So coming soon. So just a reminder, all previous presentations and agendas and resources are uploaded to our ground ambulance homepage. The list of all funding opportunities is constantly being updated, so check that out if you're looking for funding opportunities and don't have time to watch every single one of these video recordings. That's a good resource. And of course, the mass decontamination is still being offered for free. It is a 6-month contract. I did get that confirmed. So if you are looking to get your N95s decontaminated to make your PP last a little bit longer, if you're able to, that contract is from May through November. We are very lucky to have this service in Phoenix in our backyard. So if you haven't taken advantage of that, or if you haven't looked into whether or not you can, I do suggest that you do. And of course, the ADHS, EMS, and 911 resources page is there with all additional information regarding COVID. If you haven't checked that out, that is routinely being updated all the time. And of course, COVID pages in Spanish. I can't emphasize that enough, especially since we have some new people on the call. Your communities that speak Spanish, this would be very helpful to you so that they can get that information regarding the COVID crisis. So if you go to the agenda and you click on the COVID pages in Spanish hyperlink, then everything will be immediately translated, and even the banners on the left are translated. So this is something that might be sent out in a newsletter or a listserv email, whatever the case might be. If you have a population of Spanish-speaking individuals, this would be very helpful for them. If you have any specific COVID questions, do not hesitate to email them to us. So email us covid@azdhs.gov. So any questions that we haven't answered that you would like answers to, chat box is available. You can unmute yourself, press *6 to go ahead and say them verbally. You could always email me after the fact. I always get a flurry of emails regarding different questions, different programs. I'm definitely able to help out with any questions that you might have. So please, any questions, concerns, or even additional information. If you know something we don't know, we would definitely love to hear it. You can *6 to unmute yourself. Well, I guess that's a no.
Thanks, Catherine. Thanks all.